third one I have here is the barriers faced by people with a mental illness or consumers in their return to work. And I think you've learnt some lessons there.
Yes, yes, that we soon saw the value of employment. Also was aware that the majority of people we're working with wanted to return or start work, but how difficult it is for that population to get and keep a job. That starting a new job is one of life's greatest stressors, and mental illness is stress related, so it's highly likely that somebody will experience some symptoms sometime after starting a new job, or their stress levels will be increased. And for those people who have chosen not to disclose for very understandable reasons, they're then starting a stressful experience without being able to draw on the support that they are entitled to. And so not only are they not getting the support they need because of having a mental illness, a lot of people talked about feeling uncomfortable because they hadn't disclosed. And then there's the stress of starting a new job and feeling awkward about asking yet again, how do I use the photocopier? And the support system that you may have in place is only going to be able to take effect after hours or in the lunch break. And so we saw a lot of people get supported to start a job but struggle to keep the job. And so it did seem very important to look at options where a disclosure-friendly work environment can be created. And there are many other areas that make it difficult for people to sustain work, and I think working with the individual and their support team to ensure that gaps that may be required are filled, so that if somebody does need time off because of their mental health, that there is a strategy in place established so that the work can continue until they're able to return to their position.
Okay. So there's some of those barriers are the barriers that we'd all face in returning to work or starting a new job.
Yes, yes.
Getting used to a new environment, all of those things.
Yes, but how we cope with that stress will vary, and what the results of that stress will be. So you or I might get stressed. You might feel you need another cigarette, or
I might want to step on a computer,
talk too much or talk too little.
Yes.
And we all have to manage our stress. But for people who experience stress-related illnesses, that will mean that there might be more likelihood that they'll feel anxious and paranoid, or that the voices will recur, or they won't sleep, which then increases the likelihood that some of the symptoms might develop. And then there's the risk of not being able to concentrate and disorganized thinking, and then the anxiety of feeling you're not doing a good job. And we all will feel, as you say, anxiety, paranoia. It's just to what level we experience it at, and how we can manage it. And I think people with mental illness, same as everybody else, can learn coping strategies, and so become better able to identify those environments that are going to be stressful, and identify the warning signs for themselves, and then develop strategies to reduce the first. And if they can't reduce the first, as in the case of a new job, manage some of their early warning signs, or take suitable preventative actions to reduce the effect of those side of it.